Hey guys, how are you all? Welcome back to MedSteps YouTube channel. Before we begin, I'm happy to share that we are starting a brand new first aid series on this MedSteps YouTube channel. This series is perfect for medical students, interns, and anyone who wants to understand medical concepts clearly from basic to advanced. I will explain each topic step by step with visuals, mnemonics, and clinical points to help you remember and apply what you learn. So let's get started with our very first episode, that is rotatory cuff muscles. So I'm myself Dr. Anand Jana. So rotatory cuff muscles. Before going to topic, we have to understand that basic anatomy about rotatory cuff muscles. So if you are seeing this image, you can see here that this is the shoulder joint, or we can call glenohumeral joint. It's a ball and socket joint formed by the humeral head and the glenoid cavity of the scapula. Its incredible range of motion is made stable by a set of 4 muscles known as the rotatory cuff muscles. We have here one mnemonic. In this mnemonic, if you are seeing here, that is SITS. That means S means Supraspinatus, I means Infraspinatus, T means small one Teres minor, S means Subscapularis. Okay, so here first one we are discussing about Supraspinatus. This Supraspinatus, it's helping for initiates abduction. That abduction is also 0 to 15 degrees of the abduction. It's mainly innervated by suprascapular nerve. Okay, this is the supraspinatus. It is like that's a movement. The range of motion is abduction. That is also 0 to 15 degrees of the abduction, and it's innervated by suprascapular nerve, and its abducts are initially before the action of the deltoid. That means before take over the deltoid muscle, this supraspinatus will take the action. Okay, most common rotatory cuff injury is happened in supraspinatus, and we can see sometimes like trauma or degeneration and impingement also. If we are doing like MRI, in MRI we can see some of the impingement or tendinopathy, or sometimes we can see the tear also. Okay, so what we have to do for this thing, we can do the empty can test or full can test. Okay, next we are going to discuss about infraspinatus. This infraspinatus mostly help for external rotation. Okay, and same now, that is suprascapular now will innervate. Next, teres minor. Teres minor also will do external rotation, but this teres minor is innervated by axillary nerve. Okay, next subscapularis. This is very important because this is like unique. It will do the movement of the internal rotation and adduction. Here is innervated by upper and lower subscapular nerve. Okay, so this supraspinatus is most commonly injured, especially with overhead activities and trauma. And already mentioned, we can do for test empty can test or full can test for evaluation of supraspinatus integrity. So we can check some common pathologies like rotatory cuff tear, tendinopathy, and impingement syndrome. Okay, so what are the things I mentioned? Everything already here is written. So just I will read one time. just see this presentation. Shoulder muscles that form the rotatory cuff like sits, Supraspinatus, Infraspinatus, Teres minus and Subscapularis. Okay, T is for teres minor. Supraspinatus is innervated by suprascapular nerve. It abducts arm initially before the action of the deltoid. That means it will come like 0 to 15 degrees. Don't forget, it's very important in medical field. Most common rotatory cuff injury like trauma or degeneration and impingement, and it can cause like tendinopathy or tear. For this evaluation, for investigation, we have to do imaging, that is also MRI, and it's assessed by, we can do some special test, that is like empty can test and full can test. Next one, infraspinatus, that is suprascapular nerve and externally rotates arm and pinching injury. Like another one, third one, teres minor, that is like axillary nerve and its adducts and laterally rotates arm. Subscapularis, upper and lower subscapularis nerves, it will help for medially rotates and adducts arm. It's innervated by primarily by C5 and C6. So in conclusion, the rotatory cuff is critical for shoulder stability and function. If any damage to any of these muscles or their nerves can lead to significant disability. So understanding this anatomy is key for diagnosis and management. So don't forget to like, share and subscribe, and stay tuned for episode 2, where we will explore arm abduction and nerve control in details. Okay, take care, bye bye, thank you.